Come in.
Hello, how are you?
Hi, I'm good, thank you.
I'm Sean, I'm your nursing assistant. What I'd like to do is some mouth care and denture care. Is that okay with you?
Yes.
Alright, you mind if I check your ID bracelet? Alright, Miss Teresa. I'm going to go wash my hands and gather some supplies and we'll get started, okay?
Alright.
Alright, at this time I'm going to go wash my hands. When I return, I'm going to don my gloves. And anytime I place gloves on, I'm thinking about the resident's privacy. Miss Teresa, may I close your your door?
Of course.
Alright. I almost said bedroom door. I guess it's a bedroom. It's where she lives and there's a bed in it and it's a room. Alright. Okay, Miss Teresa, I'm going to do your denture care first. I see that your dentures are sitting here. I'm going to go ahead and set up because I'll get all the supplies out for your mouth care as well. Okay. I'm going to need a couple towels. Miss Teresa, may I go on your bedside table?
Sure.
Alright. And I'm going to pour a little cup of water. There's usually a bottle of water really close by. Okay. Alright, so on her bedside table, she'll either have, she has an emesis basin, some toothpaste, a toothbrush, and in this case I see a denture brush, which is really good. They're really useful in cleaning the dentures properly. I'll show you the difference here in a second. Alright, so I'm set up to do the second half of the procedure. Miss Teresa, you have the call bell in your hand. I'm going to go into the sink and I'm going to take care of your dentures, okay?
Alright.
Alright, so at this time I'm going to take your dentures that are in this denture cup, some toothpaste and a denture brush. This denture brush has a little pointy end that helps you get in all the crevices there to clean the dentures properly. So let me go do that now. Okay, now I'm going to demonstrate how to clean dentures. As you can see, I have a lot of items in your hand. So first you want to make sure you get some items set down. Of course, if we place items on a table like this, we need some barriers. Okay, we don't ever place it directly on the table itself. So we're going to create some barriers here. We're going to be very careful with these dentures. And we have our toothpaste. Okay, so now I know that I have some basins. I'm going to go ahead and raise my toilet seat because I know that some of my stuff in the containers will go in there. And it's very important now, since we're cleaning dentures, we're going to go ahead and line the sink with a couple napkins. What that'll do is create a pool inside of the sink. So if we drop the dentures, they don't hit the porcelain and break. Hopefully they'll fall in the pool and they'll be just fine. So let me go ahead and line the sink. Okay, so we're going to clean these dentures using cool tepid water. So let me go ahead and turn this on. Now you don't want to turn this water on too fast because it will overflow. So we have a nice steady pace right here and the water is nice and cool. So let's go ahead and get our dentures here. Alright, I'm going to go ahead and take my dentures out and I'm going to hold them over this area and I'm going to dump the contents here. Now we can come back to this denture cup. Actually, I've dumped the water out of there. I'm going to set these dentures back down and I'm going to have my denture brush here and put a little toothpaste on it. Now the denture brush has a little pointed tip so you can clean inside the dentures a lot better. So let me go ahead and apply a little bit of toothpaste now. Okay, go ahead and set this down. And now I'll go ahead and grab my dentures out of this cup, being very careful to get them over the sink. Alright, I'm going to rinse them off first. And then you scrub them much like you do teeth. You can use a regular toothbrush for this as well. Okay, and remember you're being timed, so you don't want to be here forever. But it doesn't take that long. A lot easier than brushing teeth in somebody's mouth. Alright, so let's go ahead and rinse these. Alright. And I'm going to rinse this denture brush. Alright, I'm going to go ahead and take this denture cup and make sure it's nice and clean and put some fresh, cool tepid water in there, about halfway. I'm going to place my dentures in them, and then I'm going to place the cup on the dentures. Now it's pretty safe, okay? I'm going to place this off to the side, and now all I have to do is clean my basin. You guys have all seen this before, nothing new. I'm going to put some water in here, swish it around. All the contents go into a bedside commode. Now, I'm going to go ahead and rinse the outside. All we have to do is rinse it from cleanest to dirtiest and dry it from cleanest to dirtiest, okay? Alright, let me go ahead and dry it so I can turn this water off. And let's see if I can dry this basin. From outside in, or cleanest to dirtiest. Alright, and since I have my barrier still sitting over here, I can go ahead and use this napkin to shut this toilet seat. And I'm going to go ahead and roll these napkins, these that are lining the sink, in on themselves so the water will drain. Okay. Now that's done, I'm going to put the toothpaste and the denture brush back in here along with the dentures. I'm going to dispose of my barrier, and I'm going to grab that barrier to walk back so I can place this stuff back in the bedside table. That's all there is to it. Just be very careful with those dentures. They're very expensive. All right, let's go return these items now. Miss Teresa, do you mind if I go on your overbed table again and put your supplies away?
No, no.
Where would you like your dentures to be placed at?
You can put those back in my
Okay.
bedside table.
All righty. You always want to ask the resident where they want their dentures, as they may need them. They need to know where they're at. I'm going to need the toothpaste actually. I'll place the denture brush right back in. And I'm going to go ahead and change my gloves at this time. You can break this down into 2 procedures and it'll be much easier. It's very important that you change your gloves between these procedures, okay? As we've been over in the sink and stuff, we don't want to bring any bacteria or germs back from that sink. All right, Miss Teresa. Do you mind if I place this clothing protector in your lap?
Sure.
Okay. This will keep me from getting you wet or making a mess, okay?
Okay.
All right. All right. I'm going to go ahead and place some toothpaste on your toothbrush. Just a note for test day, you don't want to put too much toothpaste on this toothbrush because it'll really foam up and your resin will have to spit a lot. Okay, Ms. Teresa, would you like to wet your whistle? All right, there we go. Okay, so you do mouth care with a person with dentures much in the same way except for you're cleaning their gums. You can break it down into quadrants. So I'm going to brush her outside gums, her inside top, and outside top and front. And then her bottom lowers, right side and the left side. I'm going to go ahead and clean her tongue. Would you like to spit, Miss Teresa?
Mm-hmm.
Okay. All right. I'm going to go ahead and clean her gums. Okay, and the roof of her mouth. All right. Would you like to spit again? Or you want to rinse, Miss Teresa?
Yes, please.
Okay. Okay. And just clean your chin there. All right, Miss Teresa. Now this emesis basin is shaped perfectly to go around the chin, so really helps to keep anything from being spilled. All right, Miss Teresa, do you need anything else? You have your call bell there? Mm-hmm. All right. So let me just clean up a little bit. I'm going to go ahead and dump the rest of my water here into my emesis basin. And I'm going to take my toothbrush and my emesis basin back to the bathroom to wash. I'm going to dump all the contents into the bedside commode or the toilet, rinse from outside to in, or clean to dirty, and dry from outside to in, or clean to dirty. And I'm just going to rinse the toothbrush out, okay? All right, when I return, All right, Miss Teresa, do you mind if I go back in your bedside table?
Sure.
All right, I'm going to put her supplies away now that everything's clean. Right back where I found them. And let me go ahead and clean the rest of this linen up and put the bedside table over bed table back where it belongs. All right. Miss Teresa, can I open up your door?
Yes, thank you.
All right, you're welcome. Okay, and I'm going to come back over here now that we're done, and I'm going to conduct a post-procedure check. I can see she has her call bell. She's sitting up straight. Everything looks great. The door's open. The area's tidy. Everything is back where I found it. I'm going to go ahead and deglove. Go wash my hands using proper technique and announce to the instructor or the evaluator, end of skill.